Thank you. Good afternoon, ladies and gentlemen. I welcome you all to today's session hosted by FICCI and India Sanitation Coalition. I'm Meenakshi Devan, CEO, India Sanitation Coalition, and I'd like to briefly introduce you to the topic of today's discussion, good hygiene, stepping stones to business sustainability. India has entered its unlock phase, and business and individuals alike have a role to play in contributing to a COVID-safe country. The biggest challenge businesses are facing right now is restarting their operations and getting their business back on track. The need of the hour is to continue practicing good hygiene at all times to prevent the virus from spreading. We at India Sanitation Coalition believe that for India to get back to work and continue staying at work, hygiene and sanitization will play one of the most key roles. Not only do we need to practice personal hygiene, but also ensure good hygiene is maintained in and around us. With that, let me introduce you to the keynote speaker of our event today, Ms. Naina Lal Kidwai, Chair, India Sanitation Coalition, and past President, FICCI. Naina retired as Executive Director on the board of HSBC Asia Pacific and Chairman of HSBC India. She has received several awards and honors in India and was awarded the Padma Shri in 2007 for her contributions to trade and industry. Welcome, Naina. Over to you.
Yeah, thank you, Meenakshi. I'm glad that you brought that to an end before I needed to cut you short. But thank you, and thank you everyone who's joined on this important subject today. I have to share with you that when we started the India Sanitation Coalition, which predated Prime Minister Modi's commitment to the Swachh Bharat mission, little did we know that everything we worked for then would be as alive and as necessary today as indeed it was when we set off. So the messages of 5 years ago were around washing hands, using toilets, washing hands, hygiene, making sure that we could communicate at every level, rural and urban, to bring clean sanitary habits, while also, of course, encouraging people to use the toilet. And it was only later in our Swachh Bharat mission itself from government, and a little earlier by us at the India Sanitation Coalition, that we began to push the agenda of treatment of fecal waste. And these two themes, the themes of wash and the theme of keeping our toilets clean and maintained and looking to the treatment of fecal sludge, are critical today in this COVID pandemic for obvious reasons. One of the messages that stands out all the time from politicians to Bollywood stars to whether, the sort of scripts and tickers on every screen, it's about washing hands. And believe me, when we started 5 years ago, trying to get people to do just that seemed such a challenge. And then we despaired that now it's done, it's happened. India is declared itself in many districts as ODF. Is that effort to keep that wash agenda alive going to drop away because everyone is just going to be spending less, both time and money, on that subject? And then guess what happens? The COVID pandemic. And suddenly that messaging is right back up there. So good habits, good hygiene are current no matter what. And we are delighted at the India Sanitation Coalition to bring forth a lot of that work that happened on communication. Many of our members who carried these messages, corporates, NGOs, institutions like UNICEF, who have all worked in these spaces, to basically now refresh that work with a little bit of remessaging or change around COVID, but make sure that that great work that happened does not go to waste. And it happened not just through verbal messaging, but there were games and toolkits and all kinds of methods that were used at the time. The challenge, of course, And I bring in the whole issue of SDGs. And the good thing now is companies are beginning to look at their CSR agendas through the lens of SDG. So SDG 6.1, which brings in the wash and hygiene agenda, has, of course, highlighted the need for water. And the challenge in this wash environment, and particularly if we are insisting and suggesting that people wash their hands frequently, is linking the availability of water, forget drinking water, but just hand washing water, into people's daily lives. And again, the good thing is that the government has committed by 2024 to bring running water and drinking water into every home. So in the process, I do hope that this linking of water and wash is clearly established for this agenda going forward. I would just add that for us at the India Sanitation Coalition, the work on sanitation, which gets covered largely under 6.2, is again important because while as of now, the linkage of virus and the COVID virus and SDG 6.2 highlights the need for treatment, we have not actually seen clear medical evidence that the COVID virus spreads through fecal sludge management. But there's indication now that measurement of that fecal sludge can show us the degree or existence of COVID in that community. So it does help with identification and treatment. And it's quite possible that research will show, as is the case with many viruses, that viruses thrive in environments that are unhygienic, including untreated fecal sludge. So we don't rule that out. And hence, our work in sanitation has to now keep going forward with double vigor in view of the dangers of pandemics such as this, which have brought nations, including ours, to a grinding halt. So I only, at some level, revel in the fact that old messages come back to us in new ways, in ways that teach us to refresh the work we do and to continue what we do. So to all of you who have been on this agenda and are clearly amongst the enlightened ones, I can only say thank you and don't lose heart in this environment. We need every minute of your time, your energy, your intellect in taking this important agenda of hygiene and sanitation forward. Thank you. Meenakshi, over to you.
Thank you, Naina. May I introduce you now to the moderator of today's panel on good hygiene, stepping stone to business sustainability, Sanjay Gupta. Sanjay is a strategy and policy advisor consulting with the World Bank. Sanjay has over 2 decades of senior level experience in the areas of water and sanitation, environment, climate change, gender, and livelihoods across South and Central Asia, Europe, and the USA. Our panelists for today are Aloka Majumdar. Aloka is Senior Vice President and Head of Corporate Sustainability for HSBC India. Her expertise lies in the fields of education, skills, financial inclusion, environment, and climate change. Anand Shekhar. Anand has been Team Leader, Project Management Center, FBMG, from 2017 to 2020. He has led the implementation of the Global Sanitation Fund in India, ensuring impact and transformation change at scale. He has supported national and state governments for enabling access and effective use of improved sanitation facilities and improved hygiene at scale. Arvind Wable. Arvind has served as CEO at FCB Ulka India and CEO FCB Singapore, as well as an advisor on the FCB Ulka board. Arvind is actively involved in social, environmental, and conservation issues and is the Vice President and Trustee on the board of WWF India. Geetika Mehta. Geetika is a seasoned sales and marketing professional working with Unilever for almost 17 years across foods and home care. She is currently General Manager for the Home and Hygiene business for South Asia. Martin Easter. As Chief Scientific Officer, Martin is leading a team of scientists responsible for the development of rapid methods in microbiology and related applications. He was one of the founders of Hygienia, a leading company dedicated to providing rapid solutions for cleaning verification and rapid microbial detection systems. And finally, last but not the least, we have Neeraj Jain. Neeraj Jain is PATH's India Country Director since June 2016. Neeraj comes with over 27 years of leadership experience across business development, marketing, and strategic management in organizations across Asia and Europe. Prior to PATH, Neeraj was the Chief Executive at WaterAid India. With that, over to you, Sanjay.
And Meenakshi, just before you do, I wonder if you could just announce the new campaign. Meenakshi?
Yes, Naina, sorry. Yeah.
If you could just announce the ISC's, the new campaign, Share Toilet, Not the Disease.
Sure. So our topic for today is also very topical because India Sanitation Coalition, keeping in mind how important hygiene and sanitization and sanitation is important during the COVID times, have launched a campaign on Share the Toilet, Not the Disease. A lot of those areas will also get covered during some of the discussion today, and post which I will also add a little bit more light about it during my closing remarks. Thank you.
Thank you. Sanjay, sorry, over to you.
Yeah,
so, thank you very much, Meenakshi and Naina. I think we have a great start. Just to put things into perspective regarding this panel discussion, I mean, thanks to the pandemic, Indian economy is expected to contract by anywhere between 1 to 3% this year, maybe even worse, but we are opening up, the economy is opening up. And the whole dilemma I think we face is, I mean, how do we open up more and more, reach our actual potential, perhaps even attempt to go beyond the potential which the government is encouraging the industry, the households, the service sector, the manufacturing sector to do so. The farm sector anyway is really robustly performing this year. So, but how do we do that while being safe? I mean, there are two real kind of strategies keeping safe moving forward. One is social distancing, which I think is, overall simple to understand and to put into practice most. The second is hygiene, the topic of our discussion today. And not only is, the subject of hygiene complex, but it's also really multi-dimensional. So the framework for today's discussion, let's start with the two problem Ps. The two problem Ps are pandemic and panic. Because the moment we start panicking, I think we take irrational decisions. We sometimes spend much more effort into things we should be spending less on, or don't really focus on the true problem at hand. But there are big positive Ps also, just to keep playing along the letter P. The first one is people. I think people are central to any, safety, mechanism going forward. Then our products, I think, I mean, of course, the first big product to remember was sanitizer. Everybody was running to the market. Let me get a sanitizer. Let me get a mask. I mean, so those are products. Then are protocols. I mean, but how do you really use products? I mean, what do you do? Even social distancing, what is allowed, what is not allowed in hygiene? How do you? And so there are protocols for testing, I think, which Martin is going to talk about. The other are partners. I mean, who are really the partners? I mean, corporate CSR activity has really moved forward very strongly in that direction. The civil society really is doing that. Industry associations such as FICCI now are taking the lead. So who are really the partners in addition to the government and the people? The last is really policies, I would say that. I mean, because the government policies have not only to be supportive, but to be also very inclusive, to make sure that the problem is addressed fully for everyone, and everyone is encouraged to be able to participate, meaningfully in the whole process. So just keeping this framework in mind, let me first go to Neeraj, the last person to be introduced, but the first one for the question. I mean, Neeraj, Gandhi put cleanliness even above political freedom, I mean, so, but, unique to South Asia, perhaps, has never been a trigger for hygiene or sanitation. Has the COVID-19 pandemic change that? Can really we expect health now to be used as a factor by government, by businesses to change the way we look at sanitation and hygiene? What do you think?
Thanks, Sanjay. That's an interesting question. And, for somebody who works in public health, we always used to talk about a pandemic. We used to try and tell the world that it's coming. We used to tell everybody, let's be prepared. But I must say we are as unprepared as we could ever think that we would be. But just going back to your sort of introduction where you said, pandemic and panic are two sort of bad words. Actually, from a public health perspective, I think they're fantastic. We've been telling the world, wash your hands for many, many, many years. We've been talking about hygiene for many years. I think we're seeing 7 billion people just turning around and starting to think about this, thanks to COVID. I've been telling my kids, they're 14 and 12, I tell them to wash their hands all the time. Now they're telling me to wash my hands, and they're doing so, very regularly, and they are maintaining hygiene. So I think what COVID has actually done is something that Gandhi was unable to do, which is really to get the imagination of this population going and really to explain what could go wrong if you didn't do it. We kept talking about it, but unfortunately, Gandhi didn't see a pandemic during his lifetime. We are seeing one, it's an opportunity. But I think just moving on from there, it's not just an opportunity. And that's where, Gandhi's statement of it being more important than democracy and all of that, it's very clear that this is not just going to have an impact on COVID. This is going to have an impact across diseases. It's going to have a population-wide impact of better health. It's going to have a population-wide impact of understanding. And your five, you said 5 positive P's, they're actually being driven by the 2 negative ones. So if policy doesn't come into place, if people don't come together, if organizations don't, if products aren't built around it, we're never going to be able to deal with the situation. So absolutely, I think it's a sad way to learn a lesson, but I think the world has learned its lesson. We need to follow that. I think there's going to be a lot of collateral advantages. Just, the last thing that I'd like to say is that from an organization's perspective, they don't have an option but to actually work around this newfound interest in health from the population. Everybody is going to look at organizations that care about these issues, organizations which are working around it, building their environments around such solutions for these kind of inhibitions. And, we'll all have to adjust to it. It will also start impacting talent management, recruitment, retention. Everything is going to revolve around how an organization is going to respond to this situation. So, while we aren't in a very happy situation, I must say, but I think we have finally realized that, and we're chasing 200 vaccines right now globally, all right? Actually, the best possible vaccine is washing hands and being hygienic. So I think the message is good. It's a loud and clear message.
Thank you very much, Neeraj. Now over to Geetika. I think taking off from the last point that Neeraj made, Geetika, about organizations. You coming from the corporate sector with so many years of experience, really. Which type of companies do you think should be really taking the good hygiene in the country? Within, whether it's manufacturing, offices, factories. Does HUL have any good practices to offer? Being the largest FMCG player with so many large backward and forward supply chains. Geetika.
Thanks, Sanjay. So firstly, I think these are unprecedented times, and the importance of WASH has never been more clear. I think every intervention in WASH has become critical, especially in a densely populated country like India. What is important is for whatever company, whichever field, is to look at the area of WASH holistically in the post-COVID future. Not every intervention is for all, but I could share some of the examples from HUL, and possibly organizations will find a few which can apply to them as well. Maybe I will follow the framework you put down, the positive P's, and really talk about those around the 3 buckets of people, products, and partnering. So I think as HUL, we have always put people first. And in this time of crisis, we have ensured that all our people across the extended HUL ecosystem are safe and secure. We have provided the most comprehensive insurance to our field sales staff. We have executed strict safety protocols across our factories, across our depots, to ensure the well-being and safety of all our employees and our extended personnel. I think in the other space of the second P of product, HUL, as you know, manufactures daily hygiene products such as soaps, hand wash, disinfectants, and those are the first line of defense against this virus. That is the one that will help win this battle. And working therefore closely with the government and our various partners, we have ensured that our consumers have continued access to essential items and other daily necessities. So we are implementing strict safety protocols, not just for our own operations, but across the almost 800,000 retail stores that we work with in the country. And we have worked closely with all levels of government to help ensure that essential products could continue to be produced and distributed during the lockdown. And I think the third P that you mentioned about partnering and therefore engaging, during this crisis, we have been strategically responding to various challenges faced by the communities. We've partnered to create public awareness. We've collaborated with UNICEF to launch a large-scale campaign called Break the Chain to inform consumers about safe practices required to fight the virus. We've partnered with BMC to create a public awareness campaign. It was called Corona Se Mat Darona, sharing just simple tips, including hand washing techniques to prevent spreading the virus. We've also done a lot of donation of sanitation and hygiene products. So again, in the spirit of partnership, we partnered with the government, UNDP, as well as several NGOs to protect our protectors, which is the police force, the frontline healthcare workers, the sanitation workers, by donating PPEs. We donated masks and gloves, sanitation, health kits, food items, and therefore really supported to the needs of who are the most vulnerable, so the migrant workers, low-income communities. We provided them food packets and sanitation kits. And I think overall, we are continuing to build relationships with new partners to expand the reach of our support to those who need it the most. Currently, we're already reaching 5 lakh people from low-income communities and 1 lakh people from the migrant population. So I think it's a fallacy to think that the corporates cannot do a lot. They can, and they must pull their weight behind it. And I hope we can inspire a few more corporates to really take this on.
Thank you, Geetika. Coming to Martin, Geetika spoke a lot about products and their application, with multiple audiences and multiple, spaces of business, whether they be chains, they be factories, they be offices. But, what does really clean or hygienic mean in the context of those spaces, what should one look out for to ensure cleanliness or sanitation? I believe you could really share some insight. What really is clean? How do we?
Yeah, this is a very good point. Cleaning means different things to different people. It can mean anything from wiping a surface down to disinfection to sanitation to sterilization. But the first step in any process of cleaning and hygiene improvement is to remove the organic matter. And if you try to put a disinfectant onto a dirty surface, then you're wasting your time and your money, because that organic matter will neutralize the disinfectant that you may apply to it. In different industries, there are different measures of cleaning processes and their implementation. The food industry has done it extremely well for many years, and it's even written into global food safety standards and things like that. Similarly with the pharmaceutical industry. But what has surprised me about other sectors, including healthcare, is that most people rely on visual assessment. Well, it's been described by a number of research organizations as being of questionable value. And there's a great quote from H.J. Harrington, which says that measurement is the first step of control and improvement. If you can't measure something, you can't understand it. And if you can't understand it, you can't control it. And if you can't control it, you can't improve it. So measurement is critical in the cleaning process. And a number of observations made, particularly in healthcare, and this is coming from the US, that if you are monitoring people's activities, then surprisingly, they do a better job. And if you monitor people's ability to clean, then the improvement increases from 40% to 80%. If you then give them something quantifiable that you can engage with the cleaners, it improves their motivation, their morale, their pride in delivery of that cleaning service. And it also has a big economic impact. So if you think about it, if we apply a sanitizer onto a surface, we are, a lot of that is cost is in the labor that's involved in it. There are some estimates in the West that this is 90% of the cost. And yet, if you don't get it right first time, you're wasting a lot of time and money. And there's a productivity report that was conducted in the UK, which spends over £500 million a year simply on cleaning. And the Lord Carter report said that simply improving the way that cleaning is delivered will save £90 million a year. So there's a cost imperative as well. And it all requires some simple form of measurement. And a simple form of measurement exists. It's been used in the food industry for decades. It's used across many different industrial sectors. It's a simple test that it measures ATP bioluminescence. It gives results in 10 seconds. It's a direct objective measurement of cleanliness. It can be performed at the point of use by virtually anyone. And because you get a quantifiable result, it gives you data. It tells you what has been cleaned and how well it was cleaned. That gives you an immediate risk assessment that you can do something about immediately. You can clean it again. And also it builds in that data for long-term trend analysis. A big example of that that's currently being used is in Singapore. Singapore have got an island-wide initiative called Singapore Clean, which is all about engaging with providers of services to ensure specific hygiene processes within their operation. And it goes everything from coffee shops to hotels, to travel, to government offices, and it encourages best practice. And they use a simple rapid test to deliver that. And those simple rapid objective measurements gives you that opportunity to seek the source of the contamination and then to improve it.
Thank you very much, Martin. Thank you. Now let me turn attention to Aloka. Aloka, we heard the previous, at least Neeraj and Geetika focus a lot on really engaging people, spreading awareness. Given your background as a financial journalist, what do you think is the role of mass media in helping industry leaders really take the right decision? Rather than panicking or ignoring the hygiene aspect, within their workspaces, whether it be factories or offices. Aloka, please.
Thank you, Sanjay. Actually, a very important question, Sanjay, because particularly for someone like me who has worked in the community space for a long time, we have seen that how much behavior change is important. Because today when you work on any community program, for that matter, on anything, it is behavior change, and it has to be consistent. And the first time we are faced with a situation where we need behavior change. We, as in the very large number of people. And, we never thought that we need it. I think Neeraj mentioned a very important point, saying now his children are telling him, wash your hands. So it's like the other way around. Now, I think the media will have to play a very, very critical role. And I think the first role that they have to play is actually consistent messaging, because this is not going away, right? This is, like we see, this is something which is going to stay with us. And therefore, the importance of consistent coverage and consistent messaging will be a very, very critical component, I think, of this entire crisis that media can do, and media will have to play a critical role, is what I believe. The second is also getting leaders into this conversation, because typically, you know, the leaders speak about business. The leaders speak about technical things, about profits, etc. This is the first time, I think, now to get leaders on the table to speak about this very critical thing is going to be important, and that's something that media can drive. And the third is, I think, what Gitika mentioned, best practices is also something which can be shared by media. So I think that media will have a very, very important role in consistent messaging, getting the leaders into this in the conversation, and then having best practices. So these, I would say, will be critical for the media.
Thank you very much, Aloka. Now let's go over to Arvind. Arvind, Aloka spoke a lot about the external communication channels. Let's come to internal. I mean, despite all the hygiene process and protocols, the role of people in an office or factory is most important. I mean, we can become aware, but what Aloka was saying was really behavior change. So, I mean, how do you really go over from simple awareness to behavior change? I mean, what kind of internal communication should business leaders and managers be undertaking to address these issues? Arvind.
Okay, interesting. I think the time is right for us to discuss this, because any strategy of any kind is probably only as good as the people who implement it. So people become the core for successful implementation of any strategy. Fundamentally, I think the question you've raised just now about people and the role of people, I think what we are asking organizations to do and people to do is a change, a culture change. Okay, culture is not really strategies and documents and protocols and processes. Culture is what we do every day. That's what organizational cultures are made of. Organizational cultures are made of how we interact with people, what we do. So it's the same thing with hygiene. I think hygiene needs to be an intrinsic part of an organizational culture. And like everything else, I think it's a tough task. And the tough task is because this culture is made out of habits, and habits are formed over a period of time, and we continue to do certain things without even realizing why we're doing it, what we are doing. It's an automatic response. And as we all know, habits need consistent reminders to change. Okay? So I'm just going to give it an interesting twist. If you had to set a new culture for an organization or make hygiene a part of the culture of organization, what would you do? Okay. The first thing in any culture change or habit change is clarifying the meaning. So it's not as important in culture to see what you're doing. The more important thing is why we're doing it. Unfortunately, most communication becomes the what. This is what you were doing. This is what you should do from now, right? The more important point is why. And I think that's why this change and getting more hygiene, better hygiene habits into the organization, the why needs to be discussed. The good news is with COVID, a lot of the why has already come up front. Okay. But yet, I think every organization needs to deal with the why. The other thing is COVID has also laid down the groundwork of the other aspect of culture change, which is very important, which is identifying when, if you were to make the change, how things get better, right? Because people need to see the new culture, right? Because otherwise it's a theoretical concept. And fortunately, again, I think COVID has given us a platform to say, if you do the right things, you have stayed away from COVID, or people have stayed by washing hands, by maintaining social distancing, etc. So that's important. Basis that, I think you need to then determine the strategies and initiatives. Also, very important in culture change is identifying wins. So there must be constantly communication of what's gone right in the organization. It must be communicated by the organization. Okay? It must be shared by people. The next thing is you need to find a group of people whom I'm calling leaders, who are the change leaders. People who are sensitive to this, who take it on in an enthusiastic manner, make them the ambassadors within the organizations for the change. So, a lot of these things are critical as a part of your communication package. It's not just behavior change communication, which is top down put into the organization. So I'm saying, I believe this is an intrinsic part of the new culture of organizations, and it should be. And so it should be dealt with as a culture change and a habit change by following a lot of these steps. Obviously, promotion and posters and all kind of innovative material is important. But unless it's put as a part of this holistic thing, I think it will not work as well. That's what I feel. Sanjay.
Thank you, Arvind. I mean, I think you've given quite a handful for the corporate leaderships to be really looking internally and how they could go forward on that. Now, let me call upon Anand, switching, tracks a little bit. Anand, I mean, small business, micro businesses, including small shops, kiosks, carts, roadside vendors, they are very vital to the Indian economy. Not only do they lend vibrancy, they are part of our culture. I mean, they provide employment to millions and millions of poor people, across the country. And right now, the discourse seems to be, if you want to avoid COVID, you avoid the cart. I mean, they are really suffering, and the small businesses are really suffering quite a bit. I mean, how do really? I mean, what is the thing that policies could do, or otherwise other partners could do to really provide a very hygienic and a confident environment that the public is confident to these small and micro entrepreneurs? Anand, please.
Sure, Sanjay. While historically, governments have faltered to pick up the game on hygiene, the government of the day was quick and fast in terms of coming up with protocols to support WASH, at the local level. Very quickly, Government of India came out with a health and safety protocol, that all businesses of all sizes, must use to deliver WASH services at the local level. It's a very exhaustive, yet very simple steps that government has suggested for businesses to adhere to while delivering WASH services. It's available publicly on government website, and it's a must read for everyone who wants to do business in the WASH sector. Secondly, Sanjay, Government of India for the first time used this opportunity of launching the second phase of Swachh Bharat mission to quickly build in a sub-element of hygiene promotion. If you see historically, only 11 countries had dedicated budgets for hygiene promotion. India does not come in that 11. But using this COVID, Government of India has now created a program which is a sub-element of Swachh Bharat Mission Gramin, and activities will be funded to ensure that sanitation workers remain safe, the environment in which sanitation business is done, that remains safe. So there is a full protocol which comes into play with Government of India adopting a sub-element on hygiene promotion. A landmark decision that Government of India took, which puts hygiene at the center, is allowing all 2.5 lakh gram panchayats to use 15th Finance Commission funds to ensure that we do business in a safe manner. So gram panchayats can now buy masks, can now buy sanitization products, can buy bleaching powders, can install hand washing points. So all of this, a blanket approval has been given to all panchayats to ensure that they use resources. Playing with your piece, Sanjay, historically, the past has not seen hygiene at the center. We never had a program with a dedicated budget on hygiene. This is a big shift that SBM Phase 2 will invest on hygiene. There is a dedicated sub-element on hygiene. And second, the paisa. There was no money. Only 11 countries had dedicated budget lines, and of them, 7 had just $1 million. Nothing more than that on hygiene. But Government of India in this program will be spending around 140,000 crores over 5 years to ensure that small businesses remain safe, adhere to the health and safety protocol that has been designed, and we are able to reach to all households with key hygiene messages, products, practices, and hygiene is promoted in a comprehensive manner in rural areas. Sanjay.
Thank you very much, Anand. Neeraj, or actually, let me go over to Geetika. Geetika, I mean, you just heard what Anand said. You obviously, HUL product across millions of very, very small outlets. Rural India, urban India, peri-urban India. I mean, do you have any protocols in place for those really small businesses? I mean, how do they transact? What kind of advice do they give to their customers? For example, are they your frontline communicators for the consumers otherwise? So, I mean, do you have those practices at all? Thank you.
Yeah, so I think what you're saying is correct. We have, of course, at HUL, we are fantastic at providing products to the most remote locations in India. But we always partner with organizations who complement our strength. So I think that's really the practice that we follow. It could be local NGOs who are deep-rooted, have community linkages, or organizations who work in education, healthcare. And we partner with social organization and sector experts to undertake behavior change campaigns. And that's really what the panelists earlier were saying as well. I think that's really critical to help Indians combat the disease, practice social distancing, practice good hygiene practice, at the same time address the immediate needs of food and nutrition. And therefore, that's what we do. We also, of course, donate. Yeah, so we donate money in the form of wash products through social organizations. We forge alliances with other governments and experts to provide support to those who are really risking their lives every day. And I think that's really at the heart of it. So we have protocols in that manner, which ensure that we are able to really implement solutions that can build livelihoods for a large number of people. So I hope that answers your question, Sanjay.
Thank you, Geetika. Neeraj, coming back to you, the other part of inclusivity, women. Really, women really could be more exposed to contamination in spaces such as toilets. I mean, what kind of special protocol provisions you believe organizations could be undertaking or should be undertaking? There is anecdotal evidence that companies are shying away actually from calling several women employees back simply because they believe they don't have those safe sanitation spaces. We look at the medium sector, the small sector, etc. I mean, how do we really move forward, Neeraj? Being very inclusive in this whole process. Thank
you. Thank you, Sanjay. I think you were cutting off at the end, but I think I got the gist of your question. Firstly, we need to get out of this whole thought process of, women something which we don't need. I think today it's essential for everyone. Are you able to hear me?
Yes, Neeraj, we can hear you, but...
Okay, great. So I'll continue then.
Yeah, please.
So, Neeraj, you may want to switch off your video because I think your voice is not very clear. So if you switch off your video, perhaps it'll come better.
Absolutely. So I think we need to get out of this thought process of women needing, some special sanitation services. You're absolutely right that in India, small, medium enterprises in general have not been very responsive. But I think in the last few years, with Swachh Bharat Abhiyan, with everything that the government has been doing, there's been a lot of shift there. I would say that this is a non-negotiable. It's not about men or women. I think in general, we need to have hygiene. We need to have it for the entire population of the country. It needs to cover the women and the men equally. And I would just sort of leave it at that and say that's an absolute non-negotiable. But just coming back to this whole issue, the second part of your question around people, women being asked to work from home, etc. There was an interesting panel discussion I was on last week where there was a question from the audience that said, because of COVID, are we going to see a shift in equity? Are we going to see more inclusiveness? And frankly, yes, we are, because people can work from home, people can work shorter hours, people with disability can be included. Women will find it much easier, like a lot of us men. I mean, I would also not mind working shorter periods from home. So that's definitely going to happen. That's just a new paradigm shift in terms of how work will happen. But I would say that from a hygiene perspective, it's a non-negotiable. We need to have hygiene standards common for men and women. We cannot, do this distinction. Hygiene needs to be maintained either way. And it could be, like a lot of spaces overseas, they are unisex spaces, but they are clean and hygienic. So, there is that option, and that's the option we need to make sure we're going. So I'll stop there. Over to you, Sanjay.
Thank you, Neeraj. Martin, coming back to you and following up on the earlier, the response that you gave. Can you just share some more information on how really, being really clean or hygienic, help in more rational behavior, number one, at every level. And two is, how does it really provide greater returns to businesses, and ensure their sustainability? And what kind of examples, have you seen? You mentioned the example from Singapore. Are there something closer home in India that you have seen? Some company perhaps that has implemented such protocols, or maybe some hospitals who have done it, some healthcare facilities? Thank you.
Yeah, good question. I'm more familiar with implementations here in Europe more than any, but there's some really good examples in UK hospitals. So, for example, there were 2 studies done, one in Wales, one in the north of England. In the north of England, where and it comes back to what was mentioned earlier on about finding a champion to drive the culture change. And once there is this commitment behind a more effective way of monitoring what we mean by clean and having a standard to measure against it, you can then implement the change. So over a period of several months, we saw the hygiene standards improve, and by that I mean the scores were constantly declining as time moved on, and that was associated in the UK with a decrease in the infections from C. difficile within the wards and the patients sector. In Wales, we saw the number of infections decrease, but also the involvement in the engagement with the staff increase, which means the attention to detail was quite different in one hospital compared with another. So one hospital had really good practices because they were using their workforce in a certain way. So instead of having shared responsibilities between feeding and cleaning, they had dedicated teams. And the dedicated teams, again, comes back to a norovirus outbreak on a cruise ship. where the test was used to monitor the effectiveness of the cleanup. And what they learned there was that, and it's a similar situation with airline cleaning, in that the first place that people go in is one team, and they go to the hotspot, which is usually the toilet and or the bathroom area, and then they move from there to other areas. What they found was if you have a dedicated team that deals with the hotspot, the toilet area, then they can do a thorough job in that area and not spread contamination further. So the turnaround time of cleaning, the reliability of the result gave that improvement in reduced infections, but also a better value in terms of efficiency of cleaning. So now we are seeing contract cleaning companies in their attempt to sell their services to hospitals. They're including a monitoring test, such as the ATP test, to give a visibility of how clean the service, how good their service is, and the value for money that they create within that business. And there are other examples. I think I mentioned Kimberly Clark. They put together a healthy workplace program, and they use the ATP test to demonstrate that if you keep your desk area and the area within communal areas cleaner, then the amount of lost days through sickness decreases and productivity increases. In sterile services, in hospitals, often a protein test is used, and it's a subjective colorimetric result. And if you replace that with a more objective, more sensitive test, then you get better monitoring of cleaning and then reduced infections. I think one study we did in India was with reusable cardiac catheters, which is supposed to be used as a single disposable item, and for wider use and for economies, they were cleaned and then reused. We demonstrated through the test that it's not a good practice, as you might imagine, because it is extremely difficult to clean those catheters, and therefore that practice was discontinued. So again, saving lives through having a better handle on what clean actually means.
Thank you very much, Martin. Really. Now, coming to Arvind, Martin really mentioned, one of the first places they look at is the toilet, or an indicator, good indicator is the toilet, But, perhaps that is also good indicator in offices, in schools. I mean, why is it, and it's a common habit in India to not, common occurrence to not come across clean public toilets, I mean, what really is it now, given the COVID-19 situation, where do you think the discourse could really move, or what now could be put in place to really find clean toilets, whether it be during commuting in offices, in public spaces, in schools, for example? I mean, how do you get that? Thank you.
Well, it's interesting that even before COVID happened, in fact, India Sanitation Coalition had carried out, as a part of Swachh Bharat mission, we did a research to go to public places and see the state of toilets in public places. It's well, sad but interesting as well to see that so what we had done is monitor on a whole list of things which I think are as relevant for COVID, which is cleanliness, availability of water, availability of soap, how often is it cleaned, etc., etc. Is there an attendant there? Including some of the issues we talked about for women. Is it safe? Are there doors in those toilets, etc.? So what came out, and what we had done was really look at places where people go most often. Okay, so government buildings and offices, railway stations, bus stations, tourist places, markets, petrol stations. Now, these are places where you have public toilets, right, for use. And we found that, unfortunately, these places, most of them which are either government or semi-government run institutions, the state of public toilets was really pathetic. And we had done this survey across the country, across the country, north, south, east, west, small town, large town. And consistently, while there were some variations, while the toilets existed, so the infrastructure existed, but the hygiene, cleanliness levels were extremely low. Now, looking at that, I think what seems to come through is somewhere there is a lack of understanding between policy implementation and, like Martin has been saying, monitoring. Okay, the policy, unfortunately, in many cases, is made without a greater understanding of ground realities. Okay, there are constraints in our country about ground realities. So we need to find innovative solutions when there are issues, whether there is a lack of water or any other resource, right? So we need to find innovative solutions to recycling water or whatever else is waterless toilets, etc. The other thing is we found very clearly, because we talked to a lot of municipal departments, many of them were not willing to talk very much, and people who actually looked after toilets. Their training levels were pathetically low. What exactly needed to be done, how they're to be maintained, including education of people who came and used the toilets. So in my view, I think what you need is certainly policy which takes ground realities into consideration, rigorous training of both people who maintain hygiene and toilets, public toilets, including people who use it. Some kind of a training needs to be imparted of how to use a toilet in the best possible manner. And finally, I think, like someone said, you need to have senior people in administration involved if this has to succeed. It cannot be a hands-off process which is passed down the line in a bureaucratic way and then expected it to be implemented. It doesn't happen. And of course, monitoring, which Martin has mentioned and stressed again and again, because only from monitoring does accountability come. So I think these are some of the key aspects of getting public toilets. I know examples because I visited toilets post this survey. Beautiful structured toilets that come outside every metro. They're beautifully designed, very modular, etc. But they were filthy. Within weeks, they were dirty, clogged. There was no water. So I think it has to be a holistic approach to public toilets if we need to have them now even at a higher standards than in Swachh Bharat Mission, in my view. That's it. Over to you, Sanjay.
Thank you, Arvind. As we know that public toilets really are one of the key links to not only keeping the society safe, but also, the corporate members of the society.
Right.
After all, they all are exposed to public toilet usage. Aloka, coming back to you, you come from such a large international bank, you think do you already have, or should banks have a system to judge financial viability of businesses based on their practices, hygiene and sanitation practice in times of COVID-19? If that is making them less sustainable, more sustainable, do you give advice to your borrowers, to your clients on this issue? So what is really the communication between, let's say, a bank and its borrower on this issue in terms of sustainability of business?
So thanks, Sanjay. So Sanjay, the important question, it's very new for us, as you know, it's just happened. But I think banks and financial institutions, we are all in the business of risk. And this will now definitely emerge as a risk that one will need to kind of look at, in your further lending decisions, is what I believe. Of course, I'm not a pure banker, but what I do understand, I think COVID is very new. So therefore, in terms of the conversation, whether we are having conversation in terms of strictly business conversation related to COVID is something that I'm still not aware of. But what I definitely understand is it has to be. Because see, you have the large the SMEs and the MMEs, as other panelists have also been talking about. There's going to be a huge impact on their businesses when it comes to hygiene and proper sanitation, and which is going to play a very, very critical role in COVID. Now, it is just not your smaller businesses or your SMEs, MMEs, even the large corporates, because your supply chain are your SMEs and MMEs as well. So as a result of which, I think in terms with an holistic approach, I'm quite sure the COVID conversation will definitely be taken up at the when you're assessing risk. How much has happened, I really don't know yet, Sanjay. But I definitely know that this is something which has to happen, because it is too risky now, because all your business decisions, at least in the coming years, is going to be quite critical, because the way things were working till now, way forward is going to be very different. So as a result of which, I think there is going to be a fair amount of discussion when it comes to the financial sector, lending decisions at large, and integrating COVID into the entire risk assessment framework. Over to you, Sanjay.
Thank you, Aloka. Thank you very much. Anand, coming to you, what kind of policies you think the government could really be putting in place for ensuring hygiene even beyond the COVID-19 pandemic? You mentioned the Swachh Bharat part 2, but that is more reaching out to the community, especially the poor communities. In terms of really the corporate practices, protocols that were put in place. So let me, I think, again come back to what I believe was an unanswered question, is really the small businesses. The very micro businesses, Anand. What is the government really doing to help them practice hygiene, sanitation, and provide confidence to all the customers that yes, if I visit a food cart, I'm still safe, I'm still fine, and thereby helping those small businesses really thrive?
Yeah. Sanjay, I can speak for the rural part of India, and there, what government is doing is giving a checklist, a protocol to the client, which are Gram Panchayats. They are seeking services from, big size, mid size, small size suppliers and business. So Government of India has given a protocol to Gram Panchayats saying this is what must be in place, must be met for sanitation business to happen, which I feel is a very unique way of putting things. If you are a careless supplier, if you don't adhere to basic health and safety protocols, you are not allowed to do business. So government is empowering the body, the local rural government, which will employ and hire services from these businesses. Government of India has also come out with hygiene promotion programs, Sanjay, where role of different actors has been clarified, and private sector can very well go, inform, educate, communicate, and sell the products. See, the challenge in rural areas is we never had money to procure, buy services or products related to hygiene. With a blanket approval given to panchayats to use 15th Finance Commission funds for hygiene promotion products and services, there is a huge market, that all private business must maximize on. So empowering the client, which for rural India is the panchayat, giving them, how and who do you hire so that basic protocol of hygiene is maintained. And secondly, pushing the market by allowing panchayats to spend, are two big policy decisions that they have taken. Third very important one, Sanjay, is all districts have been sent an advisory to hold one-day orientation with whoever is the business, with whatever size of service providers exist in those districts, and tell them what would be the future of water and sanitation and how services have to be imparted. So all 700 districts would have undertaken a one-day orientation with service providers, marketeers, sellers of products and services, and say, this is how henceforth business in water and sanitation will happen. And fourth, very important, and I'll give it to you, Sanjay, back, is Swachh Bharat is continuing its 400,000 Swachhagrahis. So most of the panchayats and villages have a dedicated cadre, which has been trained by Swachh Bharat officials on how would you communicate, what would you propagate, and how would you monitor whether sanitation and hygiene is happening as per the protocol. So I would say this quadrant of initiatives that Government of India has taken would come very handy for markets, suppliers, actors to ensure, we really push water sanitation and hygiene in the new normal. Sanjay.
Yeah, thank you, Anand. Now let's have what I call a rapid fire round, maybe, or just 1 minute idea round. So the question is addressed to all of you, and feel free to go in the order that you feel like, as long as, there is no interrupting each other. I mean, if you were the leader of an industry association, or if you were a very senior policy maker, relevant policy maker within the government, I mean, what is one thing that you would do, to really promote hygiene for a very robust economic recovery? What is something that you would really change or promote, or something that you would like to do? Should I go and nominate, or do you just, as soon as the thought comes, you want to just go ahead and start talking? Anyone ready? Number one.
I can go, actually, no problem.
Please, Geetika.
Yes, Sanjay. So I think it depends. So there is no one answer for it, which is why I thought I'll go first.
Geetika, only one answer, and please state, are you talking as an industry association leader or as a policy maker? Also clarify that.
Okay, so as an industry person, I would say think about the segments that you are in a better capacity to aid. If it's health, if it's infrastructure, I don't know, migrant workers, healthcare workers, sanitation workers, I mean, could be police personnel, and then work towards supporting them. The opportunities are immense. Collaboration and innovation is key in a time of a crisis when you have limited resources. So I would urge everybody to understand your core competency, and then see how you can add value.
Thank you. Number two, anyone?
Sanjay, Neeraj here.
Please, Neeraj.
As a policy maker, I think what we really need is a very, very clear, clearly defined hygiene standard. I would move it to actually move it towards a movement which is around right to hygiene and health in public spaces. I think that's really where I would like to go, where every individual has a right to have a safe, hygienic environment in every public space. And of course, as a policymaker, I would start with my own buildings, facilities, public health centers, district hospitals. Those are the ones which are close to my heart.
Thank you very much, Neeraj. Yes.
I'll go, Sanjay. Arvind here. So I think there needs to be the issue you touched on when you asked me the question about public toilets. I think there needs to be a very clearly defined public toilet policy and guidelines issued by the government, but which is based not at a conceptual level, but after studying the ground realities in every state and every situation. And those policies should then be adhered to, and it's like a white paper on public toilets, which should be issued, and then monitoring of that done at a regular basis. And I think that's very critical for the whole hygiene issue which you're talking about, where people face it when they go out.
Thank you, Arvind. Number four,
Sanjay, if I can very quickly respond to Arvind, because he's raising very, very pertinent point. Arvindji, Government of India for last 3 years, through an independent verification mechanism called NARS, has been studying the status of public toilets or community toilets in rural areas, and also a very rapid appraisal through its Swachh Sarvekshan Gramin. So in 3 years, we had at least 5 rounds of survey to understand, how does a community toilet look like in rural areas and how is it operated and maintained. Using that, Government of India has agreed to redesign, increase the unit cost from 200,000 to 300,000 from April, and another 180,000 community toilets will be built in rural areas. Government of India again has allowed panchayats to dip into the Finance Commission funds. It would be very useful to share here that of the total Finance Commission funds that will be made available, 50% has been tied to water and sanitation. So you can spend only on water and sanitation. And panchayats have been allowed to use a portion of that for maintenance. So Arvind, my limited point is things would improve. Government has taken note of the situation. Sanjay.
Thank you.
Sanjay,
Aloka and Martin. We'll come back to you, Arvind. Yeah, because the whole issue actually, both Arvind and I think Anand, is that the problem is never with CAPEX. It's always with OPEX. And that is where I think the whole problem occurs with O&M. But anyway, we'll come back. Martin and Aloka, I think we are still waiting to hear your wisdom, please.
From my point of view, I would just pick, as an industrialist, I would pick up on what was mentioned earlier on. COVID has shown us the need or the why we need to change. And I would pick up on Arvid's earlier suggestion on demonstrating the benefits through monitoring of this is, you now know why you need to change. This is the benefit of making a change in cleaning more effectively. And that will give a momentum to maintain those high standards as we go forward. So increase that visibility of why and the benefits of improvement. One example was from a company that makes wipes, antimicrobial wipes. They used our technology to demonstrate the correct way of using a wipe. Well, and to use the correct wipe for the correct application, because we all know how to clean, don't we? Or do we?
Thank you. Thank you. Aloka.
Yes, I think a lot has been covered. So my thing will be, Sanjay, that, when we saw Swachh Bharat, we saw Swachh Bharat plastered everywhere across India. And that was the message that was going on. I think we need to get back there with the messaging. There has to be investment in terms of getting the messaging, because we're too large a country, too many people. So therefore, I think investment in terms of getting the message out is going to be very important. That's one thing that I would say. The other is in terms of policy, I would say that if there are funding available, Anand mentioned that there is a fair amount of funding which is available, but even wherever there's a possibility, there could be a dedicated funding towards this. For example, if CSR you're spending 2%, of that 2%, there could be a small percentage that can be just dedicated for using for a purpose like this, which kind of has a certain amount of funds available for something like this. That's another thing that we can consider.
Okay. Thank you, Aloka. So I have 1 minute left, and I'm going to use that as my discretion to ask Neeraj the last question. And Neeraj will only have maybe 45 seconds, maximum 60 seconds. From what I've heard here, COVID communication is not simple communication. It involves a lot of technical, scientific, communication too, while a lot of social and economic aspects really come in. It's going to be very complex. I mean, from your background, having worked across so many sectors, both on the technical side, on the business side, on the communication side, what advice do you really have for the government, for the industry? Is how do you really go around communicating this very complex yet very, very essential, topic, not only essential now, but for, I think, decades to come, for generations to come? 1 minute.
Thanks, Sanjay. I think, the first thing that I would say is that we need to be transparent. We need to be true. We need to be able to call out what we don't know. And unfortunately, we really don't know too much yet. We don't know whether we're peaking today.
I think switch off your video, Neeraj.
I know it sounds a bit for us. So I was saying, I think we need to be truthful. We need to call out what we don't know. And frankly, we don't really know that peak. If we're peaking now, we're going to peak in November or peak next. I think ventilation is extremely important. I would say we failed globally on that till today. Communication has to be very, very transparent, very forward, very to the point, and not based on data which is not confirmed. We are in conflicting things all the time. First it's 3 meters, then it becomes 6 feet. Wear a mask. Don't.
Okay. Yeah, I think we have lost our win. So I'm just going to go ahead. Of course, one big disadvantage we've had of all this miscommunication is really, as I mentioned earlier, the panic that has set, very cruel and sad incidents, people not being allowed to be buried, movement against people who suffer from COVID not being allowed to live in places, or healthcare workers, our frontline workers, being targeted because they are, really, trying to cope with this COVID situation at hand across several fronts. And that is really partly, I think a product of this whole miscommunication where we start panicking rather than really being very rational and scientific in our approach. So now with that, thank you all really very, very much. It was a pleasure to be the moderator, and I think I had a wonderful panel. But I'm going to hand over now back to Meenakshi for her to, do the closing remarks and anything else. Thank you very much. Okay, Meenakshi.
Sure. Thank you, Sanjay. Thank you, panelists, for a truly insightful discussion. I think there's a lot that we all also in India Sanitation Coalition gained out of this discussion. So really, thank you for the insights shared. Some of the panelists did bring up the topic about behavior change and best practices and how important that's going to be in COVID and post-COVID times. And that's really what ethos behind the India Sanitation Coalition campaign, Share the Toilet and Not the Disease, which is really focused on getting India back to work. Really, because that's when I think Arvind also brought it up, the condition of common toilets, the condition of public toilets, that's something that worries everyone. And our campaign, which is on social media at the moment, really focuses on the correct usage of toilets, the do's and don'ts, what needs to be done by the institutions, what needs to be done by the individuals using the toilets, what are the protocols to be followed by the housekeeping and facility management teams. So that's really where the focus of this campaign is. What I really like is to request all our audience to definitely visit our stall in the health and sanitization arena. We're there, Hygienia is there, Sure Levers is there. So all of us are there. Do visit our stalls to know a little bit more about this topic, an extremely important topic in today's world. With that, Sanjay, are there any questions that came up? I don't want to miss out on that before we kind of wrap up, but any questions that anybody brought up that we may want to address?
I integrated a couple of questions actually into my own questions also. But let's take this last question really, I think, which is very relevant, which is that, in major cities, the per capita water supply in slums could be as low as really 20 liters of water per capita, 20 liters of water per day. Really, how do you practice? Because one of the key things is really hand washing, which is being promoted very strongly. So, if you don't really have access to water, and this is not just in cities, even in, if you look at data, even in rural communities, perhaps even 20 is a big luxury, to be honest with you, in several places, and in these times of summer, it becomes even worse. How do you really practice hygiene when you have access to very, very little water? So if any of our panelists would like to address that. Anyone?
I'll just say a few words, Sanjay, Aloka here, and then I can, other panelists can talk. I think, one of the things that we've always seen in any such intervention is the lack of an holistic approach. And that's something I think we cannot separate this. And today, even I think this entire thinking has to change, because what happens is currently we have verticals. We are going to focus on sanitation. We have verticals like, we are going to focus on health. So I think now it's time for all of us to understand that you cannot have, while there could be priority areas, which is absolutely fine, but the fact is there has to be a holistic approach, because if otherwise none of the programs are going to work, or none of these interventions are going to work. That none of the education programs are working. It's similar with women's program. If people are talking about women's empowerment, entrepreneurship, if there's no health, that's not happening. So it's basic. So even today, if you're talking about this, we have to look at water as an integral part of it, is what my two bit. Then I'll hand over.
Thank you, Aloka. I think that's really that's a really good approach. I would say that, I mean, is really, and I think that's what we were talking right from the beginning, that this is really a multi-dimensional, multifaceted issue. It's not simply, as you said, one vertical or the second vertical. I have another question actually, which has been asked. I mean, is there any option to maintain hygiene with less human resources? I mean, so can we have very cost-effective or human resources-effective way of hygiene? I think perhaps the person is referring more to maybe keeping the facilities clean, hygienic, but also in terms of, let's say, the products that we use. I mean, what really could be very cost-effective, both in terms of human resources and financial resources? Anyone?
Can I come in, Sanjay?
Yeah,
Arvind here. I've seen this whole concept of almost capital-intensive automated cleaning systems exist. In fact, surprisingly, I've seen one in New York with the whole toilet gets washed once you walk out of it on its own. The whole thing gets sanitized automatically, and then the next person comes in. Okay. But I think in our country, we have a great resource as people, and we need to use them. The only thing is, I think there needs to be better training and monitoring. And I think we cannot think of ideas which are highly capital intensive, automated, etc. It will not work for us. And two, we'll not utilize the resources which we have. And we don't have the money to make automated systems for everything.
I have another question now, kind of really put, and something that we have been really talking about. I mean, that's why we said scientific communication. I mean, what is the effective sanitizer for panic? We know the sanitizer for the pandemic, but what is the sanitizer for panic? So, and I think Neeraj, now that you're back, you perhaps are, I think, trying to answer that in some way. So perhaps you would like to take a first go at that.
There is no sanitizer for panic, Sanjay, and that's what I was saying before I got thrown off. That we've just created so much panic around that it's becoming actually very difficult to manage that. So I think we need to be very careful how we communicate. I think we need to be extremely careful to be able to accept that we don't know everything. This is a new disease. We don't know whether it came from the wet markets of Wuhan, or it came from a laboratory, and a lot of conspiracy theories out there. Let's be transparent. Let's talk about what we know and evolve as we go along. So no, I'm sorry to the person who's asked this question. You'll have to deal with this one on your own.
Okay, thank you, Neeraj. I think we have 5 minutes left for closing. So now I could actually close from my side and hand it over to the organizers. Thank you very much. Meenakshi, please.
Yeah, thanks, Sanjay. So with that, I'm really just going to take the opportunity to thank you all. Sanjay, Martin, Arvind, Geetika, Anand, Neeraj, Aloka, On behalf of ISC and FICCI, thank you for taking the time out to participate in today's important discussion. A lot of interesting thoughts and topics. And I just love the way we ended. Is there a sanitizer for panic? That's really something I think that is required at this point. The people really have the fear in them. And it's very visible when you really don't see people out really in the streets, in the markets, in the malls. There are very, very few cars out there, very, very few people out at this point. So I think that's something, as Neeraj rightly said, we need to do something about allaying the fear from everyone. Till then, let's do whatever we can from a sanitization perspective and sanitation perspective and hygiene perspective. So with that, thank you all. Thanks, Naina, for joining in for the keynote address. Thank you, everyone.